evening. Welcome to Soundhealth on Lagos Television. I am Olasumbo Modupe. Each year, approximately 400,000 children and adolescents are diagnosed with cancer. It is even more worrisome that about 15 to 45% are cured in low and middle income countries, unlike in high income countries where comprehensive services are generally accessible. This is our focus today on the program. The conversation begins after COVID-19 updates.
The World Health Organization has welcomed the addition of another therapeutic to the world's arsenal against COVID-19, but urges producing companies and governments to address the high price and limited production of the Regeneron antibody combination and ensure safe and appropriate handling of the medicine. Given the high costs and low availability of the combination therapy, Unitaid is negotiating with Roche Pharmaceutical, which is currently manufacturing the drug, for lower prices and equitable distribution across all regions, especially in low and middle income countries. WHO is also in discussions with the company for a donation and distribution of the drug through UNICEF, following an allocation criteria set by WHO. In parallel, WHO has launched a call to manufacturers who may wish to submit their products for pre-qualification, which would allow for a ramping up of production and therefore greater availability of the treatment and expanded access. ACTA partners are also working with WHO on an equitable access framework for recommended COVID-19 therapeutics. WHO also calls for the sharing of technology to allow for the manufacturing of biosimilar versions so all patients who may need this treatment have access to it. Those who have been vaccinated against the COVID-19 disease could still get infected and infect other people who come in contact with them. Minister of Health, Dr. Sagie Hanire, said the only reliable way of preventing the disease is to adhere to the established public health measures, which includes social distancing, washing of hands, wearing a face mask, and others. He also urged older persons across the country to endorse COVID-19 vaccination and encourage other citizens to get vaccinated. According to the minister, the only reliable way of preventing the disease is to adhere to the established public health measures. International passports of 2,000 travelers have been suspended for failing to undergo the mandatory arrival quarantine and other protocols after returning into the country. The National Incident Manager of the Presidential Steering Committee, Dr. Mukhtar Mohammed, who disclosed this, said the government had insisted that passengers who arrive into the country, especially from high-risk countries, must quarantine in a facility provided by the government. He said the passports of those who failed to follow the protocol have been suspended for 1 year, meaning they cannot legally travel out of Nigeria within that period. Members of the civil society organizations and students on Monday took to major streets in Edo State to protest against the compulsory COVID-19 vaccination policy put in place by the governor, Godwin Obaseki-led administration. The protesters, who grounded vehicular movements in the metropolis, carried placards bearing inscriptions as "We need security in Edo, not vaccine. We will resist any form of executive rascality. Hunger is killing us, not COVID-19. Obaseki, obey court order. My body is my right. Share COVID-19 palliatives." They also threatened to completely shut down government houses, government agencies, parastatals, corporate organizations, enforcing no vaccine, no entry policies, stressing that the protest of Monday was just a warning. Speaking at the Secretariat of the Nigerian Union of Journalists, Edo State Council, the coordinator of the Freedom Ambassador Organization, Curtis Ogbebo, said they were out to express their displeasure over the compulsory vaccination in the state, noting that other pressing issues such as security should be the governor's priority and not COVID-19 vaccination.
It is still Sound Health on Lagos Television. Joining us via Zoom to shed more light on childhood cancer is Dr. Habibu Mohammed, a clinical oncologist and head of radiotherapy department, NSIA-LUTH Cancer Center, and lecturer, College of Medicine, University of Lagos. Thanks for obliging us, Dr. Mohammed.
You're welcome.
All right, Dr. Mohammed, over 400,000 children and adolescents are diagnosed with cancer. Why is there a sudden increase in case of cancer in children?
Well, just like in adults, there is a sudden increase of cancer, and this could be attributed to various factors. Part of it is that we have better diagnostic machines, and we have better, equipment to diagnose this condition, and there's also a better awareness. So once there's an awareness, there is an increase in the number of cancer you see. Also, we also have environmental factors that can which play a little role in the formation of these cancers, but largely because awareness, and we also have facilities to diagnose. That's the reason.
All right, what are the most forms of cancer seen in children now? Can you please briefly tell us?
In children?
Yes, in children.
Yes, in children, we have more of leukemias, brain cancers. Also, we have lymphomas, and there are also other cancers, the solid tumors, like those of that of the retina of the eyes, the bone, and some other ones that sarcomas generally, that's of the muscles. These are the commonest of the cancers we see in children.
All right, are there early signs to look out for, and is symptoms in adults different from that of children now?
Well, the symptoms not exactly the same, because the kind of cancer you see in children are usually not the one you see in adults. So signs and symptoms, we need a great degree of awareness to observe it at early age. Children usually at very tender age will go for immunization, and they'll go for other visits to the clinic. They need to be properly examined, and their parents need to also be very vigilant to quickly notice any change in the children, because it is very important to detect this cancer early if we want to have good prognosis, that if you want to have good outcome.
Okay, Dr. Habibu, what
so the changes could be just like a change in attitude. It could be change in attitude. Baby could just start crying more. You could see that the eye has changed. You could notice lump in the abdomen. You could observe that baby is becoming pale. You could see it may even be that baby is no longer tolerating feeds. Any change you see, it's good to bring the baby to the clinics.
All right, could it be hereditary?
Yes, about 10% of diseases of cancers you see in children are hereditary, which means they are transferred from, or the chromosome responsible for this disease is inherent in the parents. It could be recessive, but they could come, within the baby and manifest. So a good number of 10%, about 10% of childhood malignancy are hereditary.
All right, now let's look at the survival rate now, Dr. Mohammed. Now, what are the chances of surviving the disease in children?
Yes, sir. According to World Health Organization statistics, about 80% of childhood malignancy survive in the high-income countries, that's in the well-developed countries, while in the low-income country, in which Nigeria is one of it, about 80% do not survive. Only about 20% survive. And this is as a result of a lot of factors. One, the type of medical program that exists in the country, if you have good medical program that can track early the disease and that can also treat and that is also affordable, you are likely to have an improvement in prognosis. However, in the low and medium income countries, some of them have been able to achieve this, like India and some other countries that are high tech, they have good programs, even though they are medium income or low income, they have better prognosis. But where there is no good program, no good health program, and where the awareness is low, and where there are no facilities for treatment or inadequate facilities, you have high mortality rates, and it could be as high as 80 to 90% mortality in such places. Unfortunately, Nigeria is a place where we also have high mortality childhood.
Dr. Mohammed, are you with me?
I am.
Okay, so in that case, now in that...
I said unfortunately, our country also has poor prognosis. Yeah, I'm listening.
All right. Okay, so in that case, now let's look at the scenario you just painted. Now, if that is the situation, how do you prevent the condition in children? How do you prevent cancer in children?
To prevent cancer in children is a daunting task. However, we can improve the prognosis. That's the outcome if it comes. We can increase the cure rate. And the ways of increasing the cure rate is the ways that whatever we can do that can improve awareness so that we can diagnose it early. We should have correct diagnosis, not that child presents with cancer and we are talking of malaria or infection, you understand? So we should have policy in ground to improve our ability to diagnose accurately. Also, there should also be policy to make it easy financially, whether it's insurance, that can help to assess treatment without, spending everything, without minimizing cost. Also, we must have policy to furnish our hospitals. We must have centers where oncology cases can be seen, especially childhood malignancy, where they can be treated. Because if you have a place for treatment and you have a good financial scheme to help them assess treatment, I will also have good diagnosis, facilities, then we will improve quality of. However, to prevent it may be a daunting task because childhood malignancy is a bit different from adult malignancy. Most of the time, childhood malignancy is not as a result of behavior, it's not as a result of exposure. That is for adults. So in adults, you may be able to prevent, but in children, what we drive at is fast, prompt diagnosis and good treatment. Because we don't do screening in children. The screening is meant for adults, but we can still get them early and make treatment available and affordable, and that will improve cure rate. This has been done in developed countries, so we are not rewriting anything. It's just to look at what they do, study, and also implement, and then we get the same results.
All right, Dr. Mohammed, raising awareness is an issue on its own, while routine checkup is a culture that must be imbibed. How do we balance both? Because it's one thing for you to visit the hospital in this part of the country if you're not feeling fine. It's another thing for you to get a correct diagnosis. Now, how do we balance the two?
Okay, raising an awareness first. We need to raise an awareness. And one of the ways, the cheapest means to raise awareness is you have radio even in the remote areas of the country. So if we continue to educate people on the need to look out for this disease, that alone will raise our index of suspicion. And that if you can raise the index of suspicion even in parents, they'll be able to, even ask the doctor, could it be this if it is missed? That is very important. Then also, our laboratory medical centers must be up to date. We must do everything to furnish our radiology and our laboratories, because we need both radiology and laboratory to have good diagnosis. So if we have that in place and we have good awareness, I think we should be able to diagnose early and promptly too, that's correctly. And we also centers. Currently we have very few centers for treating cancer. We should have more centers, and we should have centers who will be able to render this service to children at fraction of the price we do for adults, because children are not adults. Worldwide, there's a preference to the way you treat children, as in terms of finance. So we should have centers dedicated for children emergency and concentrate on that, and the finance should be less, so that we can have better prognosis coming up, because finance is a major problem in this country. Thank you.
Dr. Abibu Muhammad, clinical oncologist and head Department of Radiotherapy, NSIA-LUTH Cancer Center and Lecturer College of Medicine, University of Lagos. Thank you so much for your expertise. We really appreciate your time.
Welcome.
All right, Sound Health continues with trending health reports. Please stay tuned. This is all we have time for today on Sound Health. Remember to report symptoms early enough to your healthcare provider. A stitch in time, they say, saves life. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.